There's like 2 boyfriends out.
I have no idea. I think it's like 85 or 100. His face? I know. He's
No, I'm serious.
Whoa.
He doesn't look old except for those brown
I know.
spots.
But he has,
Like the wobble and the brown spots, but other than that, he doesn't look old.
he
If he got rid of those brown spots,
He's so nice.
he would be, and filler underneath those eyes. And
I think eventually he'll do
So is
it.
it skin tag removal?
yes, take one. And then we're gonna do fillers too.
There's
Scars.
papers in here, but...
You wanna go to a different room? Or
Yeah.
Then let's go to a different room.
Oh, no, you don't have to go. I'll just grab.
Oh, okay, thanks.
We are about to do a little work on our nurse practitioner. She's doing filler. Where do you do her filler, doctor?
We're gonna do some filler in some acne scars. And it's really big. We're gonna do Restylane. I love Restylane for acne scars because it's just the right consistency, and we can plump it up and make it look a lot better by just putting in just a teeny little bit of filler. It's an exciting morning. We get to do a skin tag and some filler. Now, acne scars are one of the things that bothers people the most, and I'm always trying to get young people who have acne on Accutane because we can prevent acne scars from forming. And so to me, acne is an emergency. So if we can cure it before it gets to the scarring point, it's excellent for kids because it does affect your self-esteem. And you'll see our nurse practitioner is beautiful. And even though she's gorgeous, these tiny little scars on her face are still psychologically traumatizing.
They bumming you out.
They bum me out.
Bumming you out.
Okay, so I want Jessica to sit here. And well, if you guys could get a little close-up on a skin tag. In the dermatology world, we call these acrocortisones. And they're benign, they're nothing to worry about. A lot of people think that they're because they're obese or something like that. And you can see Jessica is not obese. So we really, as dermatologists, don't know exactly why we get skin tags, but we can tell you that they're more common in areas where the skin rubs against the skin. For example, in the groin, underneath the arms, etc.
I actually do wear my necklace right here, so sometimes I think it rubs on it.
Okay, so with this, it's a super, super easy treatment. And for those of you who are at home, a lot of people will do their own self-remedy. What they'll do is they'll take a pair of nail clippers and they'll clip them. They'll take thread and they'll tie them off. You can twist them and strangulate the base. But really, if you come to a derm office, we'll show you just how simple it is to have them taken care of in a safe and sterile environment. So this is our teeny little skin tag right here. And so all I'm going to do is I'm going to numb it with a little lidocaine. You ready? Mm-hmm. So we just go little teeny poke. And so what we're going to do is we're just going to take just a tiny little electric current and we're going to zap it. And boom, it's done.
Jessica?
Painless, nothing, you don't feel anything.
So it forms a little teeny itty bitty scab and it'll fall off within a week or two. The thing that I like about using the electric current as opposed to other treatment options, you know, you'll go to some derm offices and they'll actually clip them with a pair of scissors, is you can see there's no bleeding. So when she leaves here, we don't even have to do a Band-Aid or any dressing. There's no aftercare. It'll just be perfectly fine. Okay, so that's it for skin tags. Now, next, what we're going to do next is we're going to do some of these tiny little acne scars, and we're going to fill them with the Restylane. Now, Jessica's been doing treatments with the Sublative, which I think has done a really remarkable job at improving her skin. And the Sublative is a radio frequency device that heats up little tiny areas of the skin. And we see really amazing results with that treatment. However, if they're deeper, you know, sometimes we want a little bit of filler underneath there to plump them up. We do this treatment in combination with things like subcision. That's where we take a little blade and we lift up the scar with a very small blade, and I'll show you that in a minute here. Okay, so with this, we just look here, just got a little pit right here. And I know you guys don't like the light, so what I like to do is I like to just go in and then put just a little bit of filler. And you can see that almost disappeared with just that little flick. See, it's gone. Mm-hmm. Isn't that nice? Okay, so we'll do some of these. Now the easiest ones to get are going to be the rolling scars. That means the scars that when you stretch them, they disappear. Now if you have a scar that when you stretch the skin around it, it doesn't disappear, that's called an ice pick scar, excuse me, an ice pick scar or a boxcar scar. And those, you know, we have to do some sort of surgical treatment in order to make those disappear. Which is just these teeny little small.
So how many of these will shift to do?
How many treatments? I usually like people to do 3 in order to make it look better. You can see how dramatic this works just instantaneously. It's best if you use these in conjunction with a laser treatment or some ablative. And as I was mentioning, I don't know if I said it the first time, but the nice thing about the ablative is it's colorblind, which means it doesn't matter what your nationality or your skin type is, you can do this ablative on your skin. And there's very little downtime as well. You know, with the more aggressive traditional treatments like a CO2 or a dermabrasion, there could be significant amounts of downtime.
How are you feeling, Jessica?
Oh, good. It's very tolerable. Little mosquito bites.
And the nice thing about this filler too is it has numbing in it. So even if it's a little bit uncomfortable, patients start to feel. Here we go. Start to feel numb after just an injection, a single injection. I've got a little one right here. Jessica, did you have any others that were really bothering you?
No, just I think you got all of them over there.
And the nice thing also is you can see it used so little of this syringe that we have enough left over to do a second treatment. So this is a very affordable treatment as well. We typically sell this syringe for $500 when we have a special, like we have a Day of Beauty coming up in our office, and this syringe will be $375. So you can get 3 treatments out of 1 syringe. And like I said, we like to do combination therapy. Now, do you mind if I do a little subcision, or is that too much for you today?
Oh no, yeah, that's okay.
You don't mind? Okay. So we're just going to demonstrate a subcision, which I also like to combine with any kind of depressed scar. And with this, we're just going to clean her up a little bit. Now this is looking pretty good, so we don't have to get very aggressive, but we're going to do it here. So we take this specialized needle. It's called a no-core needle. And you can see if you look closely, see how it's got a little blade on it? Okay, see the little blade there? With this, what we do is we just put the blade parallel underneath the skin, and this is her worst one. So was this one worse or was this one worse?
I think the bottom one.
Yeah, I think
This
the
one here?
bottom.
Okay, so when we do this, really, really very simple. We just numb the area with a little bit of lidocaine, because we don't want to hurt our patients. That's the number one way to scare off anybody, is to hurt them. And then all we do is we take the little blade and we put it underneath this scar, like that. And then we break up the scar tissue underneath there. And that's all there is to it. Now, with this treatment also, there's really basically no downtime at all. There's a possibility of getting a bruise, but otherwise there's not a lot of downtime at all. I've had patients say things like, you know, I have holes left from doing the injection. It's just not possible with these small needles that we use. It never leaves a mark on the skin. So after this, there will be a little bit of swelling for about a day. And really, she can go out tonight, she can put a little makeup on. Some of these small little injection sites she can put makeup on even and live her life. So that's all there is to it.
Yay.
Thank you.
You're a new woman.
Thanks.
Thank you, Dr. Jessica.
Thank you, Jessica.
Thank you.
Okay, let me just put a little Band-Aid on that one. The rest, we won't even need a Band-Aid on.
Okay.
Perfect. It looks really good. You want to see it, Jessica?
Yes, definitely.